A researcher at CU Boulder has been tracking our life expectancy since the pandemic started. What he found recently took him by surprise, brought him to tears. Here's Anusha Roy.
Ever since COVID became a part of our everyday,
I've been monitoring the data on almost a daily basis.
Ryan Masters with CU Boulder has been watching death rates and hospitalizations and COVID cases when life expectancy in 2020 dropped.
Not a measure of average length of life.
It wasn't a surprise.
But what it allows us to do is summarize how the changes in death rates at every age.
But the fact that life expectancy in the U.S. kept dropping in 2021 was.
I think I was going to tear up.
Especially while other comparable countries rebounded after the vaccine rollout. A closer look brought more surprises.
Life expectancy in 2021 among the U.S. Hispanic population remained unchanged from 2020. And life expectancy in 2021 among Black Americans actually increased a little bit, about 0.3 years. It is worth, however, reminding the viewers that the catastrophic reductions that occurred in both the Hispanic and Black populations beg the question about what kinds of changes happened in 2021.
Being able to bring patients back for in-person visits and just really have conversations with patients about their not only their physical wellness but also their mental health. I think we're starting to see that. Starting to those chronic conditions starting to improve.
Jim Garcia is the CEO of Tepeyac Community Health Center.
Specialty care, I think that is an ongoing gap.
Swedish Medical Center, that's working to diversify its workforce, is optimistic these changes could eventually impact life expectancy.
Too early to predict or to draw conclusions.
So the study has yet to be peer-reviewed. Researchers themselves saying that they still have to dive into this data. But Masters, who you heard from, also said you got to think about this big picture, right? Life expectancy in the U.S. has actually been falling behind since the 1980s. So he said, don't think the pandemic was somehow caught everyone off guard, was this one-off situation, but it's been an ongoing issue, Kyle, and it's actually COVID that ended up highlighting a lot of these issues and then making them worse.
Yeah, as you've stressed, Anusha, in your reporting for the last 2 years, there wasn't anything magical about COVID in the way that it targeted communities of color. It exploited weaknesses in our healthcare system and in society.
Yeah, absolutely. And, the research here goes so far beyond COVID, right? I mean, people are also dying from overdoses and fentanyl, from healthcare issues that were put off during the pandemic, and all of that is kind of adding up. So it really is much bigger than just the pandemic.
Anusha, thank you.